So the interesting thing about my hip is that despite the fact on my x-rays I had very bad bone-on-bone arthritis and I've had it for years, on a day-to-day kind of basis, like coming to work and just going for a little walk, it really didn't bother me much. But I'm a very active person. I like to hunt, I like to hike, snow ski, surf, all these sorts of things. And those became one of these things that I could do my day-to-day stuff, but anything beyond that was out. And I couldn't live like that anymore. You know, I was actually in a great mood coming in. I was looking forward to getting this done and moving on with my life and knowing what the outcome was likely to be. So I came in and it was actually just kind of a fun atmosphere. You know, the nurses are joking around with me because they know me, obviously. So it was great. And then, you know, one of my old classmates took care of me for anesthesia and then had my surgery. And, you know, it was kind of funny. I wheeled into the operating room, or they wheeled me into the operating room, I guess. And I was wide awake, and so I knew everybody in the room. It was almost kind of like a little party. We were talking and laughing, and then of course, you know, I get on the table, next thing you know, you're waking up in recovery. So I did my therapy that I needed to accomplish and went home that same day and really never looked back after that. So the first thing they do is just get you up and make sure you don't get dizzy or your blood pressure is okay, and they check that, and if that's okay, then they just have you walk down the hall. Make sure you can do a few steps if you have stairs at your house. Make sure that you're comfortable. They fit you with a walker. Make sure you're comfortable with that you know how to use it. So they teach you those sorts of things, the do's and the don'ts, you know, that, you know, what not to do and those types of things, and then you're good to go. So my recovery went pretty much like I expected it would. I was, you know, pretty swollen and stiff and bruised for the first week or two. I think I took pain meds for the first 4 or 5 days, and by then I was just taking 1 or 2 a day, and so and using Tylenol and things like that. Up walking around, I used my walker for 2 or 3 days, and then I was on a cane after that, and then after probably 10-12 days, I haven't used a cane. So today I'm at our Westfield office, so I'll be 3 weeks tomorrow from surgery. I came back to work 3 days ago on Monday, and I'm just doing half-day clinics this week. So I did a half-day Monday, half-day yesterday, half-day today. And then next week I'll start ramping up to like 3/4 clinics and a few surgeries, and then just start ramping up to, by about 6 weeks I should be back to a full schedule.